Hello, welcome to Natural Therapeutics to prevent, treat, and recover after the novel coronavirus infection. My name is Adina Dabija. I am a licensed acupuncturist and diplomat in Oriental Medicine. I graduated Pacific College of Oriental Medicine in 2008, and I've been in practice ever since in a variety of clinical settings. But since 2017, I focused more on the top-down approach, opening Soul Center with a few partners in Port Washington to focus more on prevention and psychoneuroimmunological aspects of disease, which is my passion. So today I want to talk about things that you might be interested in having on your shelf as the cold season arrives and the schools start to open and there is more social interaction. So you want to be prepared without being afraid of this, I put it here in quote marks, novel coronavirus, because from Asian medicine perspective, there is no concept of viruses or bacteria that are there to get you. And I hope this will be the message of my presentation, because with the preparing of the bioterrain, with your, in Asian medicine, changing the pattern of your body, changing and strengthening the immune system, strengthening the upright chi, you can handle exterior invasions. And I also want to share a few perspectives on previous epidemics that historically the Asian continent dealt with, and different ideas from the history of medicine. Because as a new disease arises, it's always challenging to typify it and fit it in a category. So it's always imperative to go back to a previous experience, to history, and see what happened and how people dealt with different things in the past. So I'm gonna share the screen here. Let me see, how do I do that? And before I start talking more specifically about my topic, and in the lines of going back to history and looking at different approaches, I want to bring to your attention Dr. Sarah Josephine Baker here, who's one of my inspirations. She was a doctor, one of the first women doctor at the beginning of the 20th century. She was an infectious disease doctor, and she was dressing like a man in that time to look more like a doctor. What the idea of a doctor was popular in that time. And she said it is 6 times safer to be a soldier in the trenches than a baby in the United States. And at that time, in 1908, diseases such as infectious diseases such as measles, typhoid, and diphtheria were running rampant in the New York City's Lower East Side, with a third of the children born dying of these diseases. So she changed the approach. So rather than tracing the diseased children, she focused more on preventive approaches such as nutrition, hygiene, education. And she was so successful that she was named the head of the Child's Hygiene Bureau in the Department of Health. So I hope my presentation is in line with the values Dr. Josephine Baker was promoting at the time. So as I said in the beginning, it is always challenging to typify a new disease. So back in March, friends and patients were calling me, describing me symptoms. So It's kind of a very experiential kind of approach or endeavor, I should say, when a new disease arises, to gather data and try to correlate with your previous understanding of medicine and previous understanding of how the body works. So this is a very challenging situation for anyone practicing medicine in any format, Western and Eastern, and it's challenging the format itself. It's challenging the current understanding of disease. So it definitely triggered me to do a lot of research and try to understand human body and disease better than before. So going back to these references in history, I have to say that epidemics were described in Chinese literature as far back as 3,000 years ago. And also are other things like how the body deals with environmental changes in regular times, and how these environmental changes challenge the body's metabolism. And there are 6 main factors mentioned in this yellow book, Yellow Emperor's Classic of Medicine, that challenge the body's immune system to adapt to changing environmental conditions. They are the wind, cold, heat, dampness, dryness, and summer heat. Now, these labels here are more metaphorical and symbolical. There is no wind blowing on you and bringing you a disease. It's more like how the body tries to adapt to these factors so it can preserve homeostasis. And we see in classically, historically, in Chinese medicine, Asian medicine, it's Asian because it's a model shared by many countries in Asia, including Japan, Korea, Vietnam, so not only China. So it changes different parameters in which, according to which the body operates. And this is more in line, if you will, with the theory of Béchamp. So Béchamp said that the bioterrain matters. I think in the 18th century or 19th century, he was challenging Pasteur, who said, who came up with the theory of germs. And unfortunately, we see the Western medicine embracing pretty much this theory of germs. But Béchamp was saying that terrain matters. So on his deathbed, I think Pasteur admitted that Béchamp was right. So these external causes of diseases in Asian medicine are seen as adaptation mechanisms in terms that it challenges the bioterrain, but we see diseases arising, like epidemics arising and triggering different responses in different body typologies. So these epidemics arise in a context of very personalized approach. Asian medicine does not treat diseases historically. It treats individuals presenting with different body types, with different reactions to exterior factors. And these body typologies are described in this Yellow Emperor Classic of Medicine in the way that it differentiates. So there is a differentiation of the response according to body types to these external factors. Nevertheless, there is also a description of the epidemic toxin, EDU, an external environmental influence that triggers similar symptoms across the board, no matter what the body type is. but also the idea that when the body is strong, when the righteous chi is strong on the inside, pathogenic influences cannot invade from the outside, is still present. So your terrain matters, and I will explain in a few minutes how you can prepare this terrain. So Asian medicine historically combined these two models of preparing the terrain, but also dealing with the toxic chi coming from outside, which must be expelled, which must be extinguished in a way, just like a fire, or it seemed more like a snake bite, right? More like something that is coming from the outside and the body reacts the same. So we are navigating on this kind of borderline between Pasteur and Beauchamp in Asian medicine, if you will. I have to tell you though that talking to beekeepers was very interesting. I had a very interesting conversation with a beekeeper, which told me that, you know, at the beginning when a bee was stinging me, I had such a huge reaction, and I had to go to the hospital and get Benadryl, and I almost had an anaphylactic shock. And then as I started my body started to get used to this venom. Now I can have 50 bee stings in a day and nothing really changes. I mean, I don't have any reaction at all. So it's interesting. I'm not saying, you know, it's the same with any toxic exposure, but I'm saying it's so interesting how the body amazingly adapts and detoxifies, really. So what we see here, it's a lot of challenge. It's a lot of challenge to the body in terms of readjusting to this challenge from the outside. So other ideas that come from the history of Asian medicine is that this concept of fire toxin, Ho-Du, toxins from the environment or improper medicine or long-standing diseases act like toxins in the body. So again, this idea of bioterrain. So if you already operate when a new pathogen arrives or triggers you, or a new insult from the environment triggers you, if you already operate, if the body already operates on an inflammation kind of background, of course there will be more challenging for the body to keep homeostasis. And this is an idea that comes from historical Asian medicine perspective. And also these toxins, these fire scars are created in the body in imbalancing of the terrain with metabolic dysfunction, such as, for instance, fever. Fever really can affect the brain functioning. And we know it from meningitis pediatric cases that sometimes the parents describe the personality of the child has changed after this meningitis. It affects the brain. Liver metabolism is challenged. The blood pressure can fluctuate. So we see this concept of general degradation of the body, and this is a factor to be taken into consideration when we deal with the convalescent state of any infection. Also, it was noticed that this new virus resembles malaria. In Asian medicine, malaria is referred to under the term Nui Bing. So that's not a concept per se of malaria, but is this idea of a consumptive disease that dries the blood, creates wind, and goes through cycles of remission and outbreak. So it lingers in the body. It's hiding somewhere in the body, becoming more active when the body is stronger. So when the terrain is stronger, the body tries to deal with this lingering pathogen and resolve it. And when the body is weak, it's fighting, it's hiding. So the classic example here is shingles for chickenpox, previous chickenpox infections. So it's the same virus, but it's presenting differently in different stage. And we see commonalities with this new virus or this new pathogen, this new factor coming from the outside that presents the characteristics of fire, this heat, and the characteristics of going through cycles, right? Cycles of remission and cycles of outbreak. As I said before, this is what we see today, a lot, this debate between different sides of medicine. The classical approach of Western medicine is embracing the germ theory and is saying that we should really focus on eradicating this virus and fighting the virus, versus the bioterrain theory, Beauchamp, promoted by Beauchamp and Claude Bernard, which promotes this idea of these pleomorphic changes of viruses and bacteria within a terrain. And this is more in line with the most recent understanding of medicine. So if you go on YouTube and search for Skip's versions presentation at NIH about his research on the virome, you will be surprised to find out how this virome, this new concept of virome, keeps in check bacteria, and even helminthic infection can activate previous virus infection, and different bacteria can keep a virus infection silent. So it's very interesting to see how this bioterrain theory that was first presented 200 years ago is now currently confirmed in a way by the modern, the newest approach. So Skip version, I can drop a link below this presentation. But why tending to the terrain is always a good idea. According to CDC data, only 6% of the infected patients died from COVID only, and the rest of them died with COVID. So in other words, the cohort, the overwhelming majority of 94% of the infected patients had comorbidities such as diabetes, high blood pressure. So the idea is that working on the terrain now and preparing yourself is a great idea. So also in the effort of finding out more about these new diseases, I'm going to share here what we know so far is that it transmits through air droplets, through oral fecal transmission. So anything related to aerosols, like even flushing the toilet without covering it, can present a risk if we have to embrace this Pasteur germ theory, right? So anything there is exposure to the transmission through air droplets, there is a risk. Now there is a lot that can be done for that, and I will share with you in the next part of the presentation. It survives on smooth surfaces, including metal. So hands washing seems to be promoted now in this line of, I don't think we know enough about contagion, but in this theory of contagion, there is this aspect of transmission. So hand washing, covering the mouth is important, but the studies are very conflicting, so I will share with you. It is silent, but as I said, contagious. The incubation can be anywhere between 3 and 14 days. And this is what we've seen in families, like one member, and I will talk about my cases. So one member is sick, and then the rest of the family gets sick. So this is what we see as practitioners. So also in this attempt to typify it and find a category, we see a disease progression in the sense that it can affect different body systems, and there is a progression of the degradation of the body towards the core. So a superficial, a milder form is presenting with fever, chills, body ache, sore throat, shortness of breath, dry cough, and maybe sweating. And this is the milder form, and it was, of course, associated by milder forms of the virus, milder strains of the virus. Now, we are not really sure this is the case because there is no accurate research on different strains, but nevertheless, there is a second type that is a little bit more severe, presenting all of the above, plus loss of appetite, nausea, and diarrhea. So there is this digestive system component. And the third form presents all of the above, but the disease progresses silently with no cough. However, pneumonia is present on X-ray, of course, shortness of breath, and sticky, very hard to expel mucus. And historically, in Asian medicine, there are descriptions of this concept of progression of disease. In Shankan Lun, for instance, the cold damage treatise, there is progression of disease in 6 stages. So we have seen this concept before in Asian medicine, and it's approached and treated very differently, as you will see. Yes, so other examples, other elements from history that might help us typify it is that it resembles Wenbing, we call it in Asian medicine, a worm disease. And it's very different than flu. It presents with fever, consumption of body fluids, diarrhea. So it can affect many body systems through dehydration. So heart, lungs, liver, and kidneys, there is this, what we call in Asian medicine, drying of the blood, creating blood clots. And this can lead with arrhythmias, can lead to strokes. And also in the recovery stage, we see lung scarring, reduced lung capacity, and also some people who need ventilators, the kidney function can be impaired. We don't know for how long, but it seems like 20% on people who survive the ventilator need to be on dialysis. And this is just a statistic. So you can see here accurate, full picture presentation of the symptoms of this new infection, including poor blood circulation, bone loss, mental health issues. There can be loss of smell, so neurological kind of symptoms like muscular weakness, loss of smell, increased overall inflammation, kidney failure, fatigue, fever, sore throat, shortness of breath, dry cough, pneumonia. So, you know, when you see this presentation and the patients start calling you, you don't really know exactly where to start, right? So this is the data that we have so far. Now, in terms of prevention, I will focus on the terrain here. And prevention includes, of course, preparing the terrain and assessing your risk for your terrain. There is this website, Dr. Mercola's website, I think it's called stopcovidcall.com. And there is a quiz there to kind of measure your risk, but actually it's a quiz for you to think about really how your body does these days. Like, how do you feel these days? How do you manage your health? So in this quiz, you'll find questions about the proper body weight And it seems like obese people have more susceptibility to this virus. Previous blood work showing previous infections such as high neutrophils and leukocytes count, or low level of vitamin D, which is acts like a steroid hormone in the body, showing inflammation. They all these factors can be taken into consideration when you assess your risk, not only for this kind of new virus, but for any like viral susceptibility. So there is this concept of viral susceptibility that is caused by the weakness of the host. So becoming stronger and more prepared in your terrain involves assessing your metabolic imbalances, your nutritional deficiencies or excesses, the hormonal imbalances, the inflammation state that you have right now in your body, toxic exposures, and unbalanced diets. So what do I mean by that? So metabolic imbalances can really focus on your alkaline versus acidic kind of environment that you have in your body. How is your diet like? Is it more acidic, more alkaline? Of course, most bacteria and viruses thrive on an acidic environment. Then is your body more anabolic or more catabolic? So we notice that this new disease doesn't affect children. They are in an anabolic state, so their body builds up. Are you more in a sympathetic state or more in a parasympathetic state? Are you more tense, stressed out, or more relaxed? So are you more like a fast oxidizer or a slow oxidizer? And I know you will ask me, how do I find out? And I will say the answer is not in the conventional medicine, because there is just simply not enough time and interest for a regular doctor visit to find your body type, your metabolic type. So you will need to see a functional medicine doctor or a holistic practitioner who does, for instance, hair mineral analysis to find out your metabolic type. There is modern research now on cancer and metabolic typing. So there is just like this new disease opens a lot of space for a conversation that it's long-term due in the standard setup about what's really going on metabolically in my body. So in the meantime, just contacting functional medicine practitioner can be helpful in the finding out your body type. Nutritional deficiencies or excesses. So it was shown that zinc deficiency, for instance, or selenium deficiency can make you more susceptible for catching anything like flu, like any virus. So supplementing with some of these minerals that are, we are deficient because the soil is deficient, it's always a good idea. Magnesium can be deficient, and this affects the calcium absorption too. So when there is not enough magnesium, there is excess of calcium. So you end up with these calcifications in your body. Or there might be an iron overload. Hormonal imbalances such as estrogen dominance. So unfortunately, most women these days suffer with estrogen dominance. And this is something to be addressed anyway. Hypothyroidism, like low iodine in your diet. So increasing the seaweed intake, or supplementing with a little bit of Celtic sea salt for your low adrenal function. So some people who are very stressed out or very tired and work after hours to make the ends meet can suffer with adrenal deficiency because the adrenals are hyperactive. So it just drains the adrenal system. Chronic inflammation. For instance, if you suffer with chronic allergies or chronic sinusitis, all this can drain your immune response or your immune system. And you can become more susceptible to anything from the outside. Toxic exposure, such as heavy metals exposure, or oxidant exposure, such as like sulfites from wine, or formaldehydes, different things that are sprayed on the vegetables. So buying organic foods is important, or starting your own garden. And of course, unbalanced diets. If you are completely vegan, you need to supplement with B12, or if you are completely on an animal diet, animal products diet, of course, you need to balance with some vegetables. So these are all factors that are related to your viral susceptibility. And unfortunately, the Western approach focuses more on this idea of viral virulence, like different strains of this virus. Some of them are very aggressive, some of them are milder, but that's not all there is to it. I mean, we don't talk about viral susceptibility in media. We only talk about this strain of the virus and that the other strain, which is one is from Italy, and that's why Italy lost so many people. I think we should really focus on viral susceptibility, because this is what we can do. So we are proactive, and it is good for you anyway to prepare a strong terrain. Now, in terms of prevention, wearing masks is advertised as lowering the transmission of the virus. But there are conflicting studies here. And there is this study in New England Journal of Medicine from April saying that only surgical masks provide, like N95s, provide some level of transmission from the source of infected individuals. But if somebody infected coughs on you, there is limited protection. So you see how wearing a cotton mask or, like a non-surgical mask cannot really offer you much protection, because you really have to have like a surgical grade. And if you have to stay in the classroom for 9 hours with a surgical grade mask, I don't think the oxygenation level can be proper for your, especially for your age. So it's a lot to talk about it. Creating a hostile environment in your nose, it's, I think, a smarter approach. It might be that by creating a hostile environment using, for instance, iodine drops in coconut oil, which is a preparation I always made for my sinus infection patients and flu patients over the years, and was proven by this study published in May that provides protection for healthcare workers. This is a study available online, so everyone can read it, how this nasal spray with povidone iodine and mouthwash during the pandemic can reduce the risk of cross-infection and can limit the spread. So I think this is a more efficient approach than wearing the mask, because if you create this hostile environment in your nasal cavity, right, any virus, it's very hard for a virus to thrive there. I talked about immunonutrition, pretty much talking about how to fuel your metabolic systems in my article published on Soul Center blog. I'm just going to mention a few ideas. So try to reduce the sugar intake. Any virus or bacteria loves sugar. So you should reduce the sugar intake. Carbohydrates, they change in sugar once you absorb it. So focus on protein and vegetables, which are high in minerals and vitamins. And have fermented foods. I mentioned the idea of this microbiome and virome. So promoting the good bacteria strengthens your microbiome, and there are studies on that. Also boosting your immune system with vitamin C, preferably liposomal if you don't have access to intravenous. And vitamin A, vitamin D, fish oil, selenium, and zinc. So all these ideas are published on Soul Center website. And I'm happy that whatever I published back in March still stands true. So you have the article there online. This is the reference. So you can read it for details about nutrition and Chinese herbs, really, and treatment. There is a chemical extracted from a Chinese herb that treats malaria, Qinghao, and the doctor who created this extraction, called artemisinin, got a Nobel Prize for medicine. And it shows now promising results in a research, in a study done by Max Planck Institute. And 100 milligrams per day, I recommend to my patients with a standard body weight of 140 pounds. Now, if you have the infection, you have to double it. If you are heavier than 140 pounds, if you are in the 200 pounds range, it is very safe to take 200 milligrams per day. And this would prevent your infection. It is safe to take it up to 3 months, and then you can take a break and restart it. So there are no side effects. In terms of treatment, as I said, not rely only on one aspect of the story. So yes, focus on bioterrain, but if you are really sick, you have to go to the doctor and do not delay the treatment. If you need oxygen, you need to be on oxygen. If you have high fever, you don't want your brain to be affected, so you have to provide some level of control of the fever with Tylenol if it's really running very high. Hydrate yourself. So most of the patients, as I said, this is a fire kind of presentation. So it's a fire raising. From the cases I saw, it feels like something hot is coming from the inside out. And you have to drink, and you have to, even if you lose your appetite, try to have soups. Lemonade, Gatorade, Pedialyte, and if you are a diabetic, you can use a meal substitute. Zinc limits the virus replication. It was proven in different studies, 50 milligrams per day. I really prefer to recommend the bioavailable chelated form of zinc, which is easier to absorb. So this is my standard recommendation for different stages of disease, including Chinese herbs. Besides artemisinin and zinc, if you have shortness of breath, I also recommend hydrogen peroxide, food grade, 3% inhalation with an inhaler. Melatonin is shown to prevent cytokine storms and protect the main organs, according to a study done in Manila Hospital, where doses as high as 36 to 72 milligrams per day were divided in 4 times a day with promising results. This is the study. And yeah, it's just, it's a hormone that we naturally secrete in our brain, and it decays as we age. As you see here, as you reach your 60s, there is almost none left to be made. So it's always a good idea to supplement, right? So typifying the disease in the first stage when there are no digestive symptoms and only shortness of breath maybe, but throat soreness, body aches and fever and sweating, which I forgot to include there. The pulse is rapid, floating and full according to Chinese medicine, where we measure the pulse and we examine the pulse and the tongue to get the full picture of what's going on with the patient. So we see the body tries to vent something out or to release something. That's why the heart pumps fast. So it feels like there is this kind of increased metabolic state with a red tongue, with a thick yellow coat. So the body tries to produce this heat to burn this pathogen. And the formula we recommend is Inchao Jiadupian, or a modification of that if it's necessary, ideally with raw herbs, or if the patient is too weak to boil the herbs, then there is this option from Active Herbs brand, for instance, where the pressed herbs peel without artificial binder can be bought. And also hydrate yourself with electrolytes. I always advise my patients to squeeze 2-3 lemons in 1 gallon of water and add a little bit of honey and maybe trace minerals and drink throughout the day. Have soups, like anything cold. You should stay away from cold foods so that your system is not, it doesn't have to do any additional effort to warm up your meal. So you have to increase your metabolic rate. Zinc, selenium, artemisinin, and melatonin, if necessary, up to 70 milligrams a day, it is proven to be safe. But I always encourage the stage 1 patients to stay with 10 milligrams a day, especially if there is this kind of cytokine storm presentation. There is this website called Earth Clinic, and individuals suffering with different things present their home remedies. And on the top of the list there is this BHT, a food additive approved by FDA, that is usually used in morning cereal, for instance, that has the highest number of entries in terms of what helps. And there is also this free book that is available about BHT. In the second stage, besides the first stage presentation, there is this digestive component in which the patient has diarrhea, cramps, nausea, loss of appetite. And the pulse looks a bit different. It's what you call in Asian medicine slippery, with a red tongue, thick yellow coat, sores and ulcerations. So it's a different formula that we recommend addressing these digestive issues. And all the supplements, the above supplements, plus Imodium, if there is intense diarrhea, there should be caution. Caution should be practiced with loss of fluids. So a little bit of Imodium if it's necessary to stop the diarrhea, so the body doesn't get completely drained of its resources. And in the third stage, where the pneumonia is present and there seems to be a progression of the disease inside, there are bitter herbs, more intense, more focus on your lungs type of formula, plus Imodium if it's necessary, and all of the above. And we'd see in terms of diagnosis, there are these distended veins under the tongue showing stagnation of the blood. So the blood doesn't flow properly. So in the recovery stage, we see this restricted circulation and weakness, this wasting of the muscles, with a deficient and soggy, thready, very thin pulse. It's a convalescent stage where if we see more restricted circulation issues, we might prescribe herbs such as Yunnan Baiyao, or more like if we see more fatigue problems, we prescribe more ginseng-based formula Renshen. I miss an N here, Renshen Baidu San. As I said, this disease can trigger sequelae for long term. So sequelae in all the main organ systems, such as lung, where there can be scarring, bleeding, and volume deficit, because there will be a muscular weakness of the diaphragm and intercostal muscles. So it's very important to do some breathing exercises. And for instance, Qigong can help, and other breathing exercises using your diaphragm and challenging your intercostal muscles to increase your oxygen uptake. I have a YouTube video on that, so I can include the link too. On the cardiac system, there is increased risk and infarction and edema, blood pressure dysregulation. So this all has to be taken into consideration in the recovery stage. There can be anemia or neurological symptoms such as sensory deficit, insomnia, loss of smell, as I said, increased stroke risk. Then there can be filtration deficit of the kidneys, hepatic scarring, hormonal deficits, possibly reproductive issues such as impotence, infertility, and menstrual problems. So in the future, if you suffered with coronavirus, I think you should make this part of your history, of your past history when you present to a doctor. So because all these things should be traced. We don't know if this virus or if this pathology reactivates. So we are still in the observational stage. So I'm going to share with you two cases. They both of them had good endings. So the first one was a friend of mine who lives in Manhattan. She's 47, she's white, has no comorbidities, she's in a perfect shape, and she's a very optimistic individual. So she called me at the end of March with the symptoms of dry cough, chest pain like stabbing, low-grade fever. She was very tired. She said, I cannot walk even 1 block. I get tired, I feel exhausted, I need to lie down. Loss of appetite, of course, insomnia, and chills. Like she said, I wake up in the middle of the night with these strange chills. And what's interesting is that she had those for the first week. And then she had to take some Benadryl to be able to sleep. She couldn't sleep without that. She couldn't rest. And then in the second week, she felt better. But then in the third week, the chills came back. So again, this idea of silent, dormant phase, and reactivation. So all her family got sick, but to a lesser extent than her. So that shows maybe there is some importance of the viral load. And she was treated by the Western medicine with azithromycin and Tamiflu at that point. I gave her modified Ma Huang Tang. I added Xixin for her cough, which is a very good herb for coughing. Zinc, I encouraged her to drink a lot. Soups and meal replacement, selenium and melatonin. She didn't have to go to the hospital. She didn't require oxygen supplementation. And her fatigue and shortness of breath lingered for about 2 months. So she was drinking a lot in these 2 months, a lot of electrolytes, and she finally felt better. So now she can walk, she's hiking. So after 3 months, she was totally back to herself. The second case, unfortunately, had some previous medical problems, asthma and acid reflux. So he had digestive problems before. I came back, I came late into the game. He called me from the hospital, and at the time when the patient is in the hospital, you cannot really do anything with herbs. So all I did was to create a hypnosis script for him and just put it on YouTube and send it to him. So he's a policeman in the Bronx. He got these symptoms of cough, chills, high fever, chest pain, shortness of breath at the end of March. And again, all his family got sick and tested positive, but to a lesser extent than him. So he required oxygen, and he didn't require a ventilator, but he had to be on oxygen for 2 weeks. So after 2 weeks, he was out of the hospital, and he had a longer recovery, which lasted for about 3 months. And the X-ray performed after 3 months showed some decreased lung capacity. So he was encouraged to do these breathing exercises. And I gave him some Qigong exercises, an herbal formula, and melatonin. He feels better now. He's totally back to himself, back to work, and his family is better too. So in conclusion, the main ideas to take home and be prepared is that do not subestimate or hyperestimate, supraevaluate this new disease. So it's transmissible. Focus on preparing your terrain. You can't go wrong with that. So what you should have in your house now is zinc, if possible chelated, selenium 200 milligrams, liposomal vitamin C to take it preventively, melatonin in 5 or 10 milligrams size, artemisinin, which you can order on Amazon, 100 milligrams from Active Herb, Gatorade, or plenty of lemons to prepare a supplemental hydration drink, and probiotics like kombucha, sauerkraut, and yogurt to work on your microbiome. Treat immediately, do not delay the treatment. It is serious. So if you have any shortness of breath, go to the hospital, get some oxygen. And just consider the potential for medium to long-term sequelae and self-observation. So observe yourself. Make it part of your medical history if you have to present yourself to the doctor in the future. So this is all I wanted to share for today. I hope this will empower you and help you to have confidence in your body, prepare your body, work with your body, work with your mind, and have a great cold season, being prepared without being afraid. Thank you.